Someone once defined a nurse as going above and beyond the call of duty. The first to work and the last to leave. The heart and soul of caring. A unique soul who will pass through your life for a minute, but impacted for an eternity. An empowered individual whom you may need for only a 12-hour period, but who will put you in yours above theirs. Nursing is a respected profession that has been around for a long time. It has come very far and it continues to grow every day. I want you to close your eyes for a minute and tell me, what's the first thing that comes to your mind when you think of nursing and nurses? If it is a woman dressed in scrubs with a stethoscope around her neck, you are not alone. The majority of nurses in the United States today are women. However, nursing began as a practice reserved for men. The first nursing school was established in India in about 250 BC. And only men were permitted to attend because they were viewed to be more pure than women. The career of nursing has developed throughout history, seeing a transformation in practice, types of caregivers, roles, and policy changes, but nursing remains a profession of caring and service to those in need. Phoebe was the first nurse, and in 55 AD, during the years of the Christian Church, St. Paul sent a deaconess Phoebe to Rome as the first visited nurse. Consequently, in 300 AD, the entry of women into nursing began. And in around 380 AD, the first general hospital was established in Rome. The earliest nurses never attended nursing school. Nuns and the military often provided nursing-like services. During the Middle Ages, early hospitals were operated by nurses who were often affiliated with religious organizations. Many of these institutions were places for patients to die, with nurses providing comfort during their final hours. In the 16th century, Protestant reformers shut down the monasteries and convents, allowing a few to continue in operation, 100 municipal hospices. Those nuns who had been serving as nurses were given pensions or told to get married and stay home. In Catholic areas, however, the role of the nursing sister continued uninterrupted. It wasn't until the 1800s that nursing became an organized practice. In the 18th and 19th centuries, the nursing expanded to include care of soldiers during many prominent wars. In 1853, Florence Nightingale served as a nurse during the Crimean War, during which she not only cared for the injured, but set standards of cleanliness in the areas where she worked. Her sanitary reforms reduced the overall incidence of infection where they were implemented. Nightingale moved on to author a book called Notes on Nursing, which was written as a set of guidelines for other nurses. She eventually opened one of the first nursing schools, the Florence Nightingale School for Nurses in London, in 1860. Due to all her contributions, Nightingale is widely accepted as the founder of nursing. Many nurses worked during the American Civil War. Later, in 1881, Clara Barton developed a humanitarian program designed to meet the needs of those affected by disaster. She served during the Civil War and understood the necessity of volunteer cooperation to meet the needs for food, clothing, and shelter for those in trouble. The organization was known as the Red Cross, and Barton served as its leader for over 20 years. At the end of the 19th century, more nurses started to work toward changing policy in leadership and education in nursing schools, identifying their role as more than that of a bedside caregiver. By implementing change, many nurses went beyond the scope of care to educate those in leadership about the need for prevention and to reach some groups of people that may have fallen through the cracks. In 1893, Lillian Wald began promoting the role of the public health nurse to help those living outside of the hospital setting. And in 1925, Mary Breckinridge started the Frontier Nursing Service to help some of the poor and destitute living in rural parts. During the 20th century, nursing continued to grow, with the addition of new programs and professional organizations designed to exactly address some of the challenges of the nursing career. The American Nurses Association started publishing the American Journal of Nursing, which continuously provides new information about research and trends in current practice. Nursing programs changed to offer students new courses to become licensed practical nurses and to require certification and testing to become registered nurses. Nursing schools began to develop from traditional hospital-based programs to university-level curricula. Nurses started to gain further education in the form of advanced degrees. In 1956, Columbia offered the first program for a master's degree in nursing. And in 1979, and Case Western offered the first doctoral program. Nursing skills developed during the 20th century as nurses fill greater roles with more critical functions. The rise of intensive care units and specialty areas saw the expansion of many areas of expertise in nursing. Nurses began to work in more specialized care settings and studied care of patients in their respective fields. Nursing schools taught skills in areas such as orthopedics, pediatrics, critical care, trauma, flight nursing, neonatal nursing, and psychiatric nursing, among many other specialties. Nurses now perform many procedures and life-saving measures that were once restricted only to the practice of medical doctors. Nursing diagnoses guide the care of patients depending on their needs during hospitalization or supervision. The role of the nurse practitioner as a type of advanced specialty, nursing, brought nurses up to a level in which they could prescribe medications, perform procedures, and follow the course of clinical patient care. Nurses play an essential role in not just the physical or emotional care of patients, but in the management of social issues, prevention of disease, and monitoring of trends. Historically, the nursing profession has consistently demonstrated its ability to adjust to changing and varied healthcare needs. It remains an extremely and highly respected profession that attracts large numbers of new recruits. There is no doubt that nursing will continue to maintain its status as a very important career, serving the health needs of not only our nation, but worldwide. As a future nurse, I can't wait to graduate, to be able to help people, and finally become part of this amazing history. Thank you.